And welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Adrian Reynolds. He's an assistant professor of professional practice. Today's Kevin MD article is What is Professional Identity Formation in Medicine? Adrian, welcome to the show.
Thanks for having me, Kevin. It's such a pleasure to be here.
All right. So, before we talk about your article, just briefly share your story and journey.
So my journey is into the academic coaching in medical education space is an interesting one. And it has been fueled by not just scholarship and theory around coaching and teaching and learning, but my own personal experiences and struggles. So I take you all the way back, Kevin, to, me as a high school student. I mean, I was a diligent, motivated, hardworking student. I mean, people who would, come to the house, they would always remember me as someone who was always studying, always in the books. But guess what they probably didn't know? I was filled with anxiety.
Mhm.
Test taking anxiety. I would show up late for exams, not because I was like slacking off or anything. I was like really sick the night before. I wasn't studying properly. I wasn't studying effectively, putting in tons of hours, but it wasn't effective at all. I was a memorizer. Like I would try to memorize all my notes, and the
Mhm.
moment I would going to take the test, if I forget any line, any paragraph, everything would just fall apart, and I just felt like my whole world was crumbling. The teachers back then, God bless them, they did their best, but they weren't trained on the science of learning, on teaching kids how to study effectively, how to learn, to retain, to recall deep understanding of the material. So that's really my background, and that's why when I teach students and trainees how to approach their material, how to approach test questions, and so on, long-term retention, all of that, I do it from a place of I would never want you to go through the same kind of struggles that I went through years ago as a student.
All right. And you wrote this Kevin MD article specifically focusing on professional identity formation in medicine. For those who didn't get a chance to read your article, tell us what it's about.
So the article is really about drawing attention to the professional identity formation of learning specialists in medical education. So in the literature on professional identification, which has been defined by Robert Merton in his 1957 piece as really when we think about the culture, the language, institutional hierarchies, knowledge base, when we take all that together and think how does it inform what it means to think and feel and act like a physician, right? So sort of we're talking about sort of the what people might call soft skills or the non-cognitive factors, right? And so we see that in the literature professional identity formation studies have primarily been centered around the identity formation of medical students, of trainees, right? However, there is a piece that's missing, and that is the professional identity formation of non-clinician learning specialists. So people who are not coming from a background of, not coming from the clinical sciences, but probably have a background in, counseling, in curriculum development, and coaching broadly speaking. How do we enter and transition into the medical education space, sitting at the table with physicians and physician scientists and clinician educators, establishing our legitimacy, our credibility? These are important questions that have been totally underexplored or even just ignored in the literature on professional identity formation. And my goal here is to bring awareness and attention to the fact that there are people like us, like myself, who we refer to as learning specialists. It's still an evolving sort of new niche area in medical education, but there are people like us who are actually doing the work of informing the professional identification of medical students by virtue of teaching them how to learn in this new environment, medical students and trainees.
So, give us an example of some roles of these non-clinician learning specialists when it comes to medical education. So, what are some examples of what that may look like?
A student came to me once, a medical student. I think, the student was in their first year. And, the student was clearly distraught, just totally frustrated, felt disappointed, defeated. And the student asked me, I'll never forget, Dr. Reynolds, did I get dumber? Right? These are so we part of what we do is mindset work. We
Mhm.
don't just give test taking tips and tricks, and it's working on shifting the mindset from one of, if I get less than an A, then I'm not good enough. So separating the student's academic performance from their personal identity. That's part of the work of the learning specialist. And so in that session, when the student uttered those words, I didn't jump straight into academic, coaching strategies per se. Part of the coaching was, let's talk about the mindset. Let's talk about who you are as a person, and then let's get into the strategies that you can use to turn things in your favor academically. Students who have failed exams, whether it's a step exams for the trainees, preparing for board exams, because they also, to a certain extent, they have struggles too academically, whether they're in a fellowship
Mhm.
program or whether they're a resident, particularly when it comes to time management, right? And so a resident or trainee may say to me, hey, clinically, I'm performing well. Like I'm the star clinically. Like I'm doing excellent patient care. However, when it comes to preparing for my board exams, studying, preparing for my ITEs, I struggle. I struggle with retention. I struggle with approaching the test questions. And so again, like I say, time management is a big, piece of that, managing the demands of, whether it's medical school or being in a training program with, finding the time to study. So when it comes to test taking, just learning in general, time management, retention, test taking anxiety, these are the issues that we help coach learners through.
So these medical students that you work with, presumably they are already at the cream of the academic crop because just to get through all the pre-medical requirements, the MCATs, and to be accepted to medical school, they're already the best of the best, right? So what is it about medical school specifically that challenges these already accomplished students?
Right. So yes, they're already accomplished, but in an undergraduate setting, right? Or many of them may have taken a gap year, have worked pursued coursework at the master's level. However, as we all know, medical school is just a whole different ball game, right? Being able to retain all this volume of information, in a short space of time, right? So a student may have crammed their way through college, right? And it may
Mhm.
have worked, but then now you're in medical school, it's like that's not going to work. So how do we approach the material differently, right? There are challenges regarding time management, regarding goal setting, regarding cognitive awareness, understanding really what you know, where the gaps are, how do you self-test for that? Understanding how to set goals that are specific, that are achievable. Like I mentioned before, the test taking anxiety is a real issue for some students. Then you have issues like imposter syndrome, right? That some students struggle with, is like, yes, I made it this far, but am I supposed to be here? I mean, I could get even really more granular with you to say that, for example, one of the biggest problems that students, even trainees, encounter is how they're approaching the study of the material.
Okay.
So for example, let's take for example a resident studying for boards in internal medicine. Their study system may look like this: I spend a few days or a week studying internal medicine, I mean, let's say GI, and then I move on to poem. It's sort of what we call block practice,
Mhm.
one system, one subject at a time. Or even if they're on a specific rotation, right, they go one topic at a time, one subject at a time. However, I say to them, tell me, how do patients present? Is it sort of one system at a time, one subject? How do you form your diagnosis? Is it just one thing at a time and then you move on? And then they go, huh. So what you're saying is the way I approach the material should sort of mirror how I approach like patients in
Mhm.
in in real life.
How common are these academic coaches and learning specialists in medical schools in general? It's been, I don't know, 30 plus years since I've been in medical school, and I don't recall having these resources available to me as a student. So, how common are these learning
I'm
specialists?
glad you asked that question because I'm a part of a stellar, growing, motivated group called the Medical Education Learning Specialists, right? I recently attended a conference following the Lead Serve Learn conference. I attended the Medical Education Learning Specialists annual conference in San Antonio, and there was like close to 300 of us.
Hmm.
So I would say, Kevin, unfortunately, the role of a medical education learning specialist is not as common as we would like to see. It has grown. So I started out as a medical education learning specialist in 2016, and even then it was like really new. I'm the first at my institution, and many of the learning specialists I interact with, they're the first at their institution as well. So I want to say starting in the, it probably started to formalize around maybe 2015 or so. But it's not that people weren't coaching before, but in terms of the professionalization of the enterprise of medical of academic coaching, as far as medical education learning specialists are concerned, it's still sort of in its infancy. And that's part of why I'm on this podcast.
So, as you know, medicine is famously hierarchical, right? Things are really slow to change in medicine. So, talk to us about some of the challenges that you face as a medical education learning specialist, kind of breaking into that hierarchical and traditional medical education mindset.
Well, I think, yeah, I would say at my institution, I'm very fortunate, right? Because my colleagues, faculty, I mean, they made room to really create and grow this position. They were already open to the notion of an academic coach, and it has really grown and evolved in terms of what we've been able to build. But I think one of the challenges, just in speaking with my colleagues, has been, even though maybe not for me so personally, but I think it's a very common challenge, is really professionalizing the role, having people understand in a concrete way what is it that we do, right? I often say to folks, like, I don't give tips. I'm not the fix it person. Like, okay, if students fail an exam,
Mhm.
send them to Dr. Reynolds. Thankfully, that's never been the case at my institution. But for other learning specialists, it is the case. And they're sort of spread thin, filling in with other sort of non-academic coaching tasks as they go along. Onboarding has been a struggle, and that's sort of one of the, that sent a light bulb in my mind when I saw an email related to how learning specialists are being onboarded, how they're being trained. Training is lacking. Consistent, training for medical education learning specialists at their respective institutions, especially for them transitioning into a role that never existed prior to them being there. So that's a big piece. I can tell you that the onboarding is sort of, a little disjointed across the board. And so we're working toward, through, this group of medical education learning specialists, we are sort of working toward more professionalization and formalization of what we do.
And in terms of a typical background of a medical education learning specialist, just give us a spectrum of where they come from, where their training is, what kind of education they have, what they've done before they've become medical
Right.
education learning specialist. What kind of spectrum are we dealing with here?
Yeah, that's a great question. So some of them have taught in the K through 12 setting. They've had university teaching experience. They're probably others are from a counseling background, academic advising background outside of medical education. Others, hold degrees in advanced or graduate degrees in psychology, might have worked as a counselor. So it's a broad spectrum in across the educational landscape. So for me, for example, my training, my doctorate is in foreign second and multilingual language teacher education. But interestingly, so basically, what that means is the short end of that is understanding how languages are acquired or learned and teaching people, like future teachers, how to teach languages. Now, interestingly, for me, the transition into medical education and academic coaching worked out really well given my background, because now I'm teaching trainees, I'm teaching students how to learn the language of medicine. And I would say all the theories, the concepts, the strategies that I have, mastered in terms of language, teacher education, and language education, I've been able to transfer into this space. So it's been one exciting journey.
And that leads me to my next question. Outside of academics, how do you contribute to medical students' professional identity formation?
We get emails from students who are not even our students at our
Yeah.
institution, reaching out for advice. We might be at a conference, at a poster session, and we meet students who have questions about how to retain material, how to
Okay.
prepare for exams, how to calm their anxieties around that, how to manage their time. So we're always sort of, that's a great question, Kevin. We're always sort of like on call, if you will, because almost everyone we meet, it's, well, more often than not, people we meet aren't really aware that such a role even exists. And they kind of find it like really interesting, right? Now, personally, for me, one of the ways in which I contribute is through my own podcast, as I mentioned on your website, Faith Meets Academia, in helping, folks who have an interest, it might not be everybody's thing, see the connection between their spirituality, their faith, and what they're doing academically. I, as an ordained minister, for sure, have always seen the marriage between what I do professionally as an academic coach, as someone involved in the learning sciences, and my own spiritual growth, and I see them as mutually informing.
All right. And for medical students who may be listening to you, when should they consider perhaps seeking the services of a medical education learning specialist?
Well, that's an interesting question, right? Because I came up with this notion of preventive academic coaching, sort of like preventive medicine,
Yeah,
right?
yeah.
I don't wait until you fail something to see a learning specialist. So for me at the University of Miami from day one, my philosophy, have always been and still remain to this day, creating a culture around the science of learning, creating a culture of learning how to learn in medical school. So in the first few weeks of medical school, our students have 4 to 5 hours, mandatory hours of study skill development, around the science of learning, so that we're not waiting until they fail something or really struggling before they come to meet with us. However, what I could offer is, if you find that you're putting in the hours, you're putting in the effort, right? And it's not translating into higher scores. It's not translating
Yeah.
to improved clinical reasoning. It's not translating to improved retention of the material. You absolutely need to have a conversation with a learning specialist. If you feel like you aren't managing your time well and you feel like every single thing on your to-do list is highly important, you absolutely need to meet with a learning specialist. If you feel like you're losing focus often, when you study, your mind is just wandering, you need to meet with a learning specialist, and then they could in turn refer you to other services if there is sort of a neurodiverse challenge there to be addressed, probably meeting with disability services, or so on. So and there's some other, there are a few tips that I could offer in terms of where medical students or trainees even make mistakes. You definitely, well, as they say, play like you practice, practice like you play in sports, right? So, on these exams, the way our learners are assessed, it's usually mixed, right? So
Hmm.
on standardized exams, it's not section by section, subject by subject, right? It's mixed. So when you're studying, you want to study in what we call an interleaved fashion, right? You want to study like subjects, similar subjects and topics, together, so that when you're presented with, a patient case, you're able to think sort of in a more, synthetic way. You're able to think adaptively and transfer knowledge across, systems and subjects, as opposed to just one thing at a time. So that's called interleaving. If I could name just a few quick, strategies,
Yeah.
I would say interleaving, retrieval practice, and spaced repetition. Those I sort of refer to as the big three when it comes to effective evidence-based studying.
We're talking to Adrian Reynolds. He is an assistant professor of professional practice. Today's Kevin MD article is What is Professional Identity Formation in Medicine? Adrian, let's end with some take home messages that you want to leave with the Kevin MD audience.
So, in terms of take home messages, I would say, for any, clinician out there listening, the challenges that trainees, that students, come upon in terms of their, whether academic or clinical performance, might not necessarily have to do with competence per se, but it may have more to do with how they are approaching the material, how they self-regulate, how they manage their time, how they set goals, and so on. So that really is to be considered. And it's important to make space for academic coaches, particularly non-clinician academic coaches, right, to have a seat at the table, because we bring a very different sort of perspective and viewpoint to the mix, right? So when we meet with students, we can genuinely say, we're not judging you per se on the content itself because we're not the content experts, but we can through coaching we can help you develop a higher sense of metacognitive awareness so that you can go into any test situation, any clinical encounter with confidence and a clearer understanding of what's expected of you. So more awareness of, I mean, if you don't have a learning strategist, an academic, a learning specialist coach on your team, you probably need one, whether you're in GME or UME.
Adrian, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you. It was a pleasure. Thanks for having me.